So there's published work which indicates that people with hematological malignancies, both during treatment and after completion of their active treatment, have lower levels of physical activity than we would see in a general normal healthy population. And there's a number of factors that probably influence on that. And one of the biggest ones is living with cancer-related fatigue. And so many patients find it really challenging to become more physically active in the context of having significant fatigue, although we know that the evidence for improving cancer-related fatigue strongly advocates being physically active and exercising. People with myeloma have specific challenges in terms of living with their bone disease. Many patients will have had a history of pathological fractures and spinal fractures. Some of our patients had been in spinal orthotics and braces for many weeks prior to our study. And so there's a huge fear around being physically active with a diagnosis of myeloma. And we know from some of the qualitative work that we've done that patients really seek out sort of specialist support, particularly from physiotherapy, and that they appreciate when that support is related to or delivered within the context of their myeloma multidisciplinary team. So our study has shown, although there's some limitations with small numbers, we have data that indicates that taking part in this program pre-transplant, pre and post-transplant, increase their physical activity in the week prior to being admitted for transplant and in the 3 months following transplant. And that's important not just for the potential effects on managing cancer-related fatigue and improving quality of life, but also I think it's important that we encourage and support people with myeloma to be more physically active, because, unfortunately many of them will go on to need subsequent lines of treatment, and I think that ensuring that we can provide adequate rehabilitation and support to be physically active during and after treatment will hopefully better physically prepare patients for subsequent lines of treatment that they may require. Some of our secondary outcomes for the study were on functional capacity and physical activity, and although the study wasn't powered to detect change in these measures, and the pandemic did limit the follow-up data that we had, what our baseline data shows from the 50 participants that started the trial is that functional capacity is actually quite low in these patients, despite having a good performance status and being transplant eligible. And so I think a particular interesting point about these patients is that often we don't, in the normal clinical setting, we don't assess objective measures of function, and functional capacity and physical activity, particularly when they're impaired, can have implications on increased likelihood of being frail or frailty, but they're amenable to exercise and physiotherapy. So an important finding for us is that if half of the patients that we assessed had low functional capacity in terms of gait speed, that actually with timely input with rehabilitation and physiotherapy, that this is something that we can actually improve for patients before they undergo treatment, whether that be transplant or other subsequent lines of treatment. And I think the use of more objective measures of function and frailty in the clinical setting would really be able to assist us in sort of identifying patients that might need more specific rehab or exercise support to improve their function pre-treatment.